Hey, I'm Dr. Navin Singh from Washingtonian Plastic Surgery. My practice is in Chevy Chase, Maryland, and in McLean, Virginia, suburbs of DC. People come to me and want to know what are their options for their neck. Well, I tell them it depends on you. Depends on how much extra skin you have, how much extra fat you have, and what you want to do. But I lay out the options. And the options include something totally non-invasive, totally external, like Ultherapy, which is microfocus ultrasound, like lasers, or CoolSculpt, which is cryolipolysis, fancy doctor way of saying we freeze the fat cells by applying an external suction cup. To Kybella, which is injections, kind of like Botox, just tiny little injections in and out, but usually takes 2 or 3 treatments. Then there's laser liposuction, one needle hole underneath the chin, possibly one behind each ear, and we just vacuum out the fat and we laser those fat cells so that they don't come back. And it helps tighten up the skin. Downtime for that, about half a day, then back to work the next day. Then, if they have a small amount of loose skin and that's because they have a small chin, I recommend a chin implant. That's surgery under anesthesia. It's a small cut, about 3/4 of an inch underneath the chin. And then if they have a lot of extra skin, a turkey neck, but don't want to undergo a facelift, we can do a direct neck lift where we cut out the skin, but it leaves a scar here, so it's better suited for older white men, typically who want to have a beard that can hide that scar. I don't recommend that for women. And then the most definitive rejuvenation is the facelift or neck lift. And that's done usually under anesthesia, although it can be done awake. That's used to treat both the separated muscles and the extra skin and fat component. And so let's talk initially about Ultherapy. It's done awake, it's in and out. It's one treatment, it lasts about 2 hours, totally external. It's like a laser, microfocus ultrasound is shot in, and you get results like this, where it tightens up the skin and helps ablate some of the fat cells. The next option is CoolSculpt. That usually takes 2, possibly 3 treatments to do. I'm not really overwhelmed with it, but it's worked well for some of my patients. It's an external applicator, it's a suction cup, it circulates cold fluid through it, so it freezes those fat cells, spares the skin, and then the body looks at those damaged fat cells and says, hey, I'm gonna clean this out of here. And these are the results that people see, but as I said, you typically need 2, possibly 3 treatments. They're done about 6 weeks, a month to 2 months apart. Then there's Kybella, and as I indicated, it's just a bunch of injections. It's these vials, these medications. It's injected through basically a Botox syringe, through a bunch of dots that we mark out the areas of fat and map out the extra areas of fat. And these are the kind of results that people see. But like CoolSculpt, it also requires 2, possibly 3 treatments. There is some swelling. I mean, there's not surgery, but there's a little bit of swelling and inflammation that can last for a few days, up to 10 days. And people come back about every 6 weeks apart for 2, possibly 3 treatments. Then there is laser liposuction. That's the laser probe, that's me holding it. It goes in through a tiny little hole underneath the chin. We vacuum it out, and you can see for somebody who has both loose skin, and that's where the laser part of the liposuction comes in. It helps tighten up that skin and gets rid of that fat. And sometimes these people have fat because of hereditary reasons. They have it because of aging, or they have it because they're overweight. Again, laser liposuction, one needle hole through here, half a day's downtime. Then there is a chin implant, and as I discussed, that's done under anesthesia. That's done through a 3/4 incision underneath the chin. This is what the chin implant looks like. It goes right on top of that through an incision underneath the chin, and it can improve the profile for somebody who has a retrusive chin and thus pull the skin forward. Often it's combined with laser liposuction underneath it. Then there's the direct neck lift, and it's done awake. And it's suitable, as I said, for older white men because the scar hides. Typically they wear a beard. I don't recommend this for women. But boy, for a turkey gobbler neck, that's a good answer. And then the ultimate rejuvenation is, of course, a facelift or neck lift. But people are, of course, worried about scars. They're worried about that Hollywood look. And we don't get that. Why? Because I tighten the skin and the muscle there. If you do that, you avoid that Hollywood stretched out look. And the incisions are in the ear and behind the ear, and they're virtually imperceptible. There's no such thing as an invisible scar, but gosh, you can barely see it on her. Again, it provides the ultimate rejuvenation, whether it's a man or a woman. In this case, you can see his incisions are hidden, and he's gotten a really nice result. So let's summarize. Neck options. Depends on the magnitude of the problem you have and your appetite. If if you want something invasive or not. Non-invasive, Ultherapy, Cool Sculpt, and Kybella. Ultherapy and Cool Sculpt totally external. Ultherapy requires 1 treatment, Cool Sculpt requires 2, maybe 3 treatments. Kybella is just a bunch of injections like Botox, and it takes 2 or 3 sessions. Laser liposuction, this little cannula goes in from a small input right here, and of these minimally invasive options, that's my treatment of choice for addressing both the skin that needs to be tightened up with the laser and the fat that needs to be removed. And then from the surgical or more invasive options, chin implant, if the person needs it. Direct neck lift, not done that commonly, frankly. And then the facelift or neck lift is the most definitive thing, and that's typically reserved for people who also want facial rejuvenation along with neck rejuvenation. I'm Navin Singh, Wash PS. Hit me up.